when we look at what's happening in very severe cases of COVID-19, specifically incidents where we have things referred to as cytokine storms happening, the issue that's going on is that the immune system in these critically ill patients has essentially overreacted to the coronavirus, and the body is essentially losing control of itself. And so the exposure of the SARS-CoV-2 virus is leading to the oversecretion of a lot of molecules like these interleukins, these IL-6 is one example. And basically these things have flooded your bloodstream, and it's leading to catastrophic inflammation, and cells can no longer successfully communicate with one another, and this leads to death in some cases because your body simply can't handle a lot of the functions that it needs to handle in order to keep you breathing and your heart pumping. So it's a very severe set of symptoms that can result in death. And so what people are beginning to wonder about is the role that vitamin D plays in this process, because from the autopsies that have been performed on patients and from what we know thus far of people who have had these extremely severe cases of COVID-19, we've learned that it's often the case that the concentrations of T lymphocytes is low. And T lymphocytes are a type of immune cell that have the job of dialing down your immune response. And so this is consistent with our expectation that in these severe cases, the body's immune system is losing control of itself. One reason it can be losing control of itself is because it does not have the T lymphocyte cells available to actually dial things back down when you need them to get dialed down. And so T lymphocyte levels in your blood, the number of these special immune cells that help your body basically control itself, are proportional, directly proportional to the levels of vitamin D that you have to a degree. And what I mean by that is in patients who are vitamin D deficient, the current studies are showing that patients who don't have as much vitamin D are not able to have as many T lymphocyte cells present. And so the line of thinking here goes that if you are not getting enough vitamin D, then you are not going to be able to have enough of these T lymphocyte cells present, and therefore when you will get exposed to the coronavirus, it is able to make your immune system dial up a huge response, but unfortunately you don't have those T lymphocyte cells present to actually dial things back down, so you don't overreact to it and end up becoming one of those extremely fatal cases. And so that is the line of reasoning that is currently being investigated in the scientific literature. And so, another thing that is very interesting to healthcare professionals and scientists is what makes the flu season the flu season? Why is it typically during the winter? And another thing here is that during the winter months, people are a lot less likely to go outside. They are a lot more likely to not get the adequate levels of sunlight that they normally would be getting. And vitamin D levels inside of our bodies is very dependent on the amount of sunlight that we are getting. So by staying inside, by not having as much of our skin exposed to direct sunlight, this can result in us being unable to create the same levels of vitamin D that we normally would. And so, a big question for us to ask here is, well, how does our body make vitamin D? And what can I do to make sure that I keep my levels of vitamin D as high as I reasonably can, so that I am as fit as possible to handle an infection by the coronavirus if I am one of those patients? And so the way that your body synthesizes vitamin D is a fairly complicated metabolic pathway, but for the sake of introduction, it's basically a molecule that is a lipid soluble thing that resides in your skin. And so these molecules, when the sun hits your skin or a photon hits your skin, it's able to change this molecule into something that I'll call molecule A, that basically moves down into your liver. And your liver has a job of taking this metabolite, or this prodrug basically, and taking some other ingredients and then converting a molecule B. So molecule A becomes molecule B once we've done some more fancy chemistry stuff. Molecule B then makes its way to your kidneys. Your kidneys do a final processing of molecule B to turn it into a molecule C that we can now refer to as kind of the active version or the more soluble version of vitamin D. And this molecule is the one that circulates around in your bloodstream, and it does the job that we already are pretty familiar with vitamin D, and that is the regulation of calcium and phosphate levels in our bloodstreams. And so deficiency in vitamin D is known to cause other things like musculoskeletal issues such as rickets, where because your body is unable to regulate levels of calcium and phosphate, the homeostasis of your bones is compromised, and therefore you can get some very bad features in the bones that make it not as structurally sound. But for the sake of this video, we're going to end things there. But basically the gist of what I'm getting at here is that vitamin D is one of these things that is very important for us to think of when we are figuring out how can we best prepare ourselves for the pandemic, how can we best prepare ourselves to be exposed to the coronavirus, because if we are vitamin D deficient, the evidence is suggesting that we aren't going to have the proper cells in place to actually help us combat the consequences of this virus to ourselves. So basically the moral of the story is to make sure that you get adequate levels of vitamin D inside of you. This means eating a right and balanced healthy diet. Fish oils and meats and proteins are these molecules that your kidney and liver are taking in order to basically help change those metabolites into the active form of vitamin D. Another thing is making sure that you get that adequate exposure to direct sunlight. And what this means is that what one study was saying is that for you to get an appropriate amount of sunlight, you should expect if 30% of your body is exposed, so if you're wearing a t-shirt and shorts, that's roughly about 30% of your skin is in now direct contact with the sun, and you're not wearing any sunscreen, and you are not wearing any clothes that are covering that, so literally just bare skin out in direct sunlight between the hours of 10 a.m. and 3 p.m. for between 5 and 30 minutes for 3 times a week would be able to get you enough sunlight to maintain these healthy levels of vitamin D. That isn't to say that we need to go outside for 4 hours a day every single day of the week, because that'll be overexposure and we're going to be resulting in other things. So the devil is in the dosage. Basically what this is telling us is that we should aim to get about 5 to 30 minutes each day, 3 days a week of direct sunlight when we're wearing clothes, but t-shirt and shorts. And understandably this is a lot more difficult for people in these darker regions of the world or these colder areas, but vitamin D is a very important vitamin, and it helps us be able to fight off diseases like COVID-19. So that is going to wrap things up for this video. I hope it helps. I will provide a brief summary and also links for you guys to read more in the description of this video. Hope this is useful stuff for you all. Please stay safe, wash your hands, take care of yourselves and your loved ones, and I'll talk to you next time.